Hello and welcome to Capitol Hill, coming to you live from Federal Parliament. But today, really, the focus is firmly on Victoria, where authorities have confirmed another 3 COVID-19 cases today. We'll jump straight into the political panel now to sort of wrap up the developments in federal politics this morning. And I'm joined by Trent Zimmerman, Liberal MP, and Labor MP Susan Templeman. Thank you for your time today.
Hi, Jane. Hi, Susan.
Now, we've had a big morning of Senate estimates, and one of the key questions has been how many aged care workers have actually been vaccinated, and the Minister wasn't able to come forth with the numbers. Why has there been such a lack of transparency over the numbers of this vaccine rollout?
Well, we're publishing numbers on the vaccine rollout every day of the week, and you can see them at health.gov.au to give the Health Department a promotion. But I think what is really important is the outcome, and we now have a situation in aged care in Victoria where 100% of aged care facilities have now received either the first or second dose, and that's a good outcome because we know that even the first dose starts to provide protection within a matter of days. So that's really the key goal, and nationally 4 states have now reached 100% of aged care facilities. The rest are at about 99%.
But given the rollout started 3 months ago, aged care residents and workers are in 1A, the highest priority group. Today, the Aged Care Minister, Richard Colbeck, said he was comfortable with the progress and pace of the rollout. Would you be comfortable if all of these people still had not been vaccinated?
Well, the vaccine program has been hit generally, but also for aged care by 2 fundamental problems. The first is that obviously with Pfizer, the storage requirements that were put in place makes it a massive logistical challenge to disperse it. And I think the Department of Health was obviously over-optimistic in its predictions that they could do the whole nation within 6 weeks. But secondly, particularly relating to aged care workers, we had that advice from the experts which suddenly overnight limited the use of AstraZeneca to over 50s, and that had a big impact.
Well, Susan Templeman, I mean, yes, there have been some problems, supply, we've seen a change in health advice. Has the government been agile enough really to adapt to those?
The whole program's been a joke, and I love the putting a bright shine on it. But yesterday, the Minister said that there are only 6 aged care facilities that hadn't received vaccines. Today, we find out in estimate it's something like 21 who haven't started vaccinating. The number of workers who've been vaccinated is down below 10% for aged care workers. So
that's what we know of. We don't actually have the data. The government hasn't collected it.
It's the whole data collection has been appalling, and you know it would be a joke if we didn't have people's lives at stake here. And these are lives in Victoria, but had things gone differently, it could very well have been lives in any other state. So while we're saying it's a Victorian issue, this is something every Australian should be thinking, why has this government bungled the rollout so badly? 110 days, and this is where we're left.
So the Victorian authorities just confirmed there that aged care workers who are in the public state-run facilities, there'll now be a blitz on vaccinations for them to get them vaccinated. Would you like to see a similar blitz for those federally run private facilities?
I think this is yet another wake-up call. The government missed the last wake-up call last year and didn't prioritise these vaccines. We should be looking at in-reach programs across the country to make sure aged care staff have the protection they need, particularly as we know now that many are working between facilities still. And that's been changed now in Victoria, although we're hearing from the unions that there's pressure being put on workers to still turn up to work, even when they're home isolating and, you know, doing their 14 days isolation. So it's real problems, and we should not be here in 2021. This is the equivalent of I don't hold a hose from last year.
Well, I just want to ask you about the single site rules. So when there's an outbreak that's been declared, like in Melbourne last Thursday, the Commonwealth said, OK, if you're an aged care worker, you can only work at one facility. We know that many work across several. Do you think it's too late to wait for a declaration of a hotspot to actually put that rule in place?
Well, that was the protocol put in place nationally, and I think in the light of this, it's not a bad idea to look at whether there's an earlier trigger point when community transmission re-emerges. But I think the fundamental point is that firstly, it's about 5% of the aged care workforce, for example, in Victoria that are working at multiple facilities. But I also think that it is a case of balancing the risk of both, because we know that the workforce in aged care is under increasing pressure, and to effectively withdraw from the aged care sector for the entire year, those that are doing multiple casual or part-time jobs could have a serious impact on the quality of care. So that's why the focus on only working a single site is triggered when community community transmission emerges. And for the rest of the time, when there's no community transmission, which thankfully, due to the great management of Australians and federal and state governments, has been the case in this country, then you don't need to apply that rule. So it is really adapting to when community transmission emerges and very quickly putting in place the measures to protect aged care.
Is that potentially too late though? I mean, because we know that at the state level they have a one-side rule all the time now since the pandemic, but it seems federally there's a different rule.
Yeah, if you haven't got quarantine right, and we haven't got quarantine right in this country because the government hasn't addressed that, you can't afford that lag time between notification of the virus leaking out of quarantine and being in the community to then, oh, we better do stuff. You know, you have to have foolproof things in place to keep people safe. What we're seeing for a second time is it's hitting aged care, the most vulnerable people, first and hardest. So let's get quarantine fixed. You know, let's learn from this incident and make sure we don't see repeats of this right round the country.
Right. Trent Zimmerman, Templeman, I'm so sorry it's been so quick, but we've got to let you get to question time now.
Thank you.